Hi, this is Dr. Derek Mahony. I'm here to tell you about a new course that we're organising at EODO. The course is entitled Treatment of Orofacial Pain, TMD and Bruxism. And the reason I've chose all three topics is because they're very much interlinked. As you may or may not know, I obviously have a degree in orthodontics and I also have a degree in dental sleep medicine. And what I can tell you is one of the common causes of TMD is parafunction. And we now understand that a lot of parafunction that occurs at night is sometimes related to apneic events, what Gilles Levine has known as sleep bruxism. So in this course, I'm going to show you how to correctly diagnose orofacial pain so you know the origin and you know what would be the appropriate treatment. When I went to dental school, all we did was make everyone a Michigan splint, right? So it was standard canine guidance and everyone got one. We now realize that this splint can worsen sleep apnea, and if the parafunction is the patient bringing the jaw forward at night to open up the airway, this could not work. Instead, you'll need to use a mandibular repositioning type of appliance. So in this course, I'll show you how to deal with people who clench during the day. Remember, teeth should only be in contact for 15 minutes of the day. These people are doing this all day long. Then we talk about what happens at night. We'll show you how to measure daytime activity and nighttime activity. And then we'll go through the different appliances. So we use pivot splints for locked joint. We use forward repositioning splints. We do still sometimes use flat plane splints, but I'll give the indication what we use and where. Second thing is, how do you then finish a case? Sometimes these splints restore a vertical dimension that was overclosed to here. And I'll bring up the controversial topic, is there a need for second phase intervention after the patient's relieved of their pain? So we're following national guidelines in this course. I have two great speakers. Mariella Rosa did her research with Professor Ivan Kleinberg, which many of you will know from Sydney University. She did 3 years of research with him. And she teaches part-time now, still involved with Professor Kleinberg. Sarkis Nabandian, he did his restorative and pros training at King's College, came back and did his master's again with Ivan Kleinberg, so he's a specialist prosthodontist in Sydney. And all of these will bring to the table what to do in a patient who presents to you with clicking jaw joint, with pain, without pain, with locking, with no locking, right? We'll show you how to measure correctly. We'll show you which patients to treat, which ones just to observe. Because I think one of the most poorly taught subjects in dental school has been diagnosis and treatment of TMD. I think the only thing we can agree on is everyone has a TMJ. After that, everything is controversial. You know, do we treat a click? When do we treat it? How do we treat it? I'll show you how a closed lock, which is a non-reducing disc displacement, is different to a self-reducing disc displacement. And I'll show you how self-reducing disc displacement should only be treated if there's a history of locking or pain. Other than that, you need to monitor where the click is. So for those who are a bit confused what to do when a patient shows up with excessive bruxism, excessive wear, overclosed vertical dimension, what to do with patients who snore, you'll see the link between constant parafunction, overloading of the joint and poor sleep problems. So I look forward to welcoming you to this EODO course. Dates are August 28th and 29th. It will be Zoomed as well because we're this day and age, we're never sure what course will be live and what won't. But if there's still border closures, we will do the live course in Sydney, but we will beam it from the Sydney facility to Zoom. So look forward to seeing you. Register early. Thank you.